Hi, Dr. Sasse here from Sasse Surgical. And I know we've addressed this a little bit before about revising prior sleeve gastrectomy procedures, but I had a patient ask recently about why is converting the sleeve to a bypass a good option for someone who has acid reflux versus another alternative procedure if they want to focus on just losing more weight and improving health and diabetes. So let me just walk through that in a little bit more detail about how we go about revising the sleeve and what the decision is. First of all, let me say that the sleeve is generally a really good option as a first option. It's not perfect like everything, and they all have their drawbacks. And keep in mind that the surgery is going to change some of the hormones from the stomach, but that's got to intersect with each person's genetics. And so you're going to get people who have a home run response and look like skinny supermodels for a lifetime, and then you're going to get people where it didn't seem to have very much effect. It's no fault of their own, and you can't really blame the surgery except until we get better surgeries, but it's just the way that biology is going to intersect, right? So you work as hard as you can at it with your diet and your exercise regimen, especially those exercise minutes, but at the end of the day it has a lot more to do with the biochemistry and the intersection with our genetic template. But if you find yourself years later, a year later, 5 years, 10 years later, with the weight having come back on or never having gone down enough, or especially if type 2 diabetes is there, then you should know first and foremost that there's excellent revision options which can be very safe, very non-invasive, and highly effective at producing better health and longevity and quality of life, and specifically treating extra weight and type 2 diabetes, among other things. But what if after your sleeve procedure you've experienced a lot of acid reflux? That can be a particularly vexing problem. Usually we start by looking at the system, and often we'll look with an endoscopy directly, because oftentimes there can be a bit of scar tissue in the sleeve, in the stomach itself, which can be treated with dilation. So a balloon is passed down and it stretches the narrowing that's occurred because of some tight scar tissue. Think of an hourglass that has sort of pinched an area that makes it hard for us to swallow and have things passed down normally. It also can pool some acid and cause acid reflux. So if a person is experiencing that and we can't really solve it with endoscopy, and we start to consider revising the procedure, then it makes sense to consider revising it toward a gastric bypass operation. Now, why is that? You may have read online that there are some studies that show revising it doesn't really help with weight loss. There's a bit of truth in that, although nowadays the way we revise it and the type of gastric bypass that we would create does generally succeed in producing excellent weight loss. Those studies were not as sort of specific and didn't use the kind of aggressive gastric bypass that can be used to cause weight loss. But more importantly, for the person who has really severe reflux, why does gastric bypass work better? The answer really lies in the fact that in bypassing the stomach, most of the stomach, and connecting the small intestine right up to the stomach pouch, what we're doing is allowing all the secretions and everything we eat and drink to pass right through the stomach pouch and right into the intestine with no blocks and no obstruction, and most importantly, no four-way stop sign, which is the pylorus. That's the valve at the bottom of the stomach. So what we eat and drink can just pass right on down through and never has to stop, and you don't have to wait for the motility of the stomach, which can be squeezing and causing some reflux. Instead, things just flow through very nicely. So gastric bypass, conversion to gastric bypass normally is highly effective at eliminating the symptoms associated with acid reflux, with food sticking, with regurgitation, a lot of symptoms that all go together that are the fairly uncommon but really unpleasant symptoms that can be side effects of the sleeve procedure. So if you find yourself in that boat, sometimes you have to weigh, would I rather do a revision that's going to solve the reflux problem and augment the weight loss and diabetes reversal moderately, or would I just want to focus solely on weight reduction and diabetes reversal? For example, if you didn't have any acid reflux, you might want to go that direction. And that would be to do a slightly different kind of bypass that we call duodenal switch or duodenal Some people use the word SADI, which is single anastomosis duodenal. But that one is not going to solve that acid reflux problem, which most people don't have. And so you get this trade-off. So hopefully I made that clearer. I'm just going to summarize here very briefly. But if you're thinking that you might need a revision to the sleeve, if you have a lot of acid reflux and food sticking and symptoms like that, then you may want to talk to your doctor about doing a gastric bypass procedure. because that's generally going to totally solve the reflux. However, if you're thinking about revising the sleeve because of weight regain or type 2 diabetes, then you may want to talk to your doctor about duodenal switch or duodenal ileostomy, because that's the most effective at producing weight loss and diabetes reversal. Okay, I hope that's been helpful. Both those options are generally quite successful, quite low invasiveness, quite excellent in safety, but high in effectiveness in the right hands with an experienced surgeon, of which there are many around the country who have some gray hairs or losing their hairs and can do a great job with that. So I hope that's helpful to you and that you find a path to improved health and longevity. Take care.